I'm delighted to be here, and I move that the bill now be read a second time. I'm really happy to be here. This is a good day in terms of legislation, a good day in terms of women's healthcare, a good day in terms of the cost of living when it comes to healthcare, because that's exactly what this bill speaks to. The core purposes of the bill have been expanded. Originally, the bill had one aim, which was to abolish inpatient charges for children in hospitals, and that's a really important step in the right direction. And it's now been amended to encompass provisions to put on a statutory basis, for the first time in our state, free contraception. We're starting with women aged 17 to 25 as per the programme for government commitment. Firstly, I'd like to focus on the initial objective of abolishing public hospital inpatient charges for children. This legislation, when enacted, will ease the financial burden of parents, of guardians, when bringing their child to hospital. When they're bringing their child to hospital for inpatient care, it'll help to ensure that cost is not a big consideration for families when children do require access to inpatient treatment. Currently, public patients, including children, are subject to a statutory charge for inpatient patients of €80 a day. That's for a maximum of 10 days a year. So essentially there's a maximum charge of €800 a year. Now this bill will put an end to that for children. It'll amend the Health Act 1970 to provide a specific additional exemption for children under 16 years of age. It's a really important step in terms of affordability. There's a lot of different things we're doing. We've reduced the drug payment scheme. We're looking at free GP care for 6 and 7-year-olds. And then the two provisions in this bill are really important. And I think it's an important signal. You know, if a parent or a guardian has a child in hospital, they're already going through a very difficult time. They're already going to be under a huge amount of pressure, under a huge amount of stress with their child in hospital. And the last thing that they need, having brought their child to hospital and having had their child in hospital for 10 days or more, the last thing that any parent then needs is a bill from the hospital for €800. And this piece of legislation is going to put an end to that, which is really very, very welcome. Secondly then, following a recent government decision, a Dáil committee stage amendment was brought forward to the bill. This is to provide free contraception starting with women aged 17 to 25. And as we've discussed here previously in the Seanad, the intention is to expand that. So what we want is free contraception for everybody. We have to start somewhere, and the expert report we got back was to start with 17 to 25-year-olds. The scheme will be open to all 17 to 25-year-old women ordinarily resident in Ireland, and it will fully cover several costs, indeed all of the costs associated. So first of all, medical appointments to discuss and to prescribe suitable contraception. It'll cover fitting and removable of long-acting reversible contraception, or LARCs, so for example implants and coils. It will cover any necessary checks for long-acting reversible contraception. It will cover the wide range of prescription contraception contraceptives currently on the reimbursement list and which are currently available to medical card holders. It also abolishes the prescription charge that is there for medical card holders for other medicines. So it really is very wide-ranging in terms of the costs that it covers. So for a woman to go to the doctor, have a consultation for implants for long-acting reversible contraception, for the pill, for other prescribed medicines, all of that will be covered, checkups will be covered, and the cost of the medicines, the cost of the devices, all covered. I'd now like to provide a brief explanation regarding the sections of the bill. Part 1 of the bill contains standard provisions setting out the short title, citation, and provides that the bill should be subject to a commencement order. Part 2 of the bill deals with exemptions from public inpatient charges for acute inpatient services. Section 3 of the bill amends Section 47A of the Health Act 1970 to provide that the new section 53C 9BB of the Health Act 1970, which gives effect to the exemption from charges for acute inpatient services for children under 16, is included for reference within Section 47A of the Health Act 1970. Section 4 of the bill amends Section 53C of the Health Act 1970. Section 53C provides that charges shall be made for acute inpatient services provided by or on behalf of the Health Service Executive. Subsection 9AA confirms that the €80 public charge is not applicable to persons who've chosen to avail of private acute inpatient services under Section 55 of the Health Act. In these circumstances, the more significant charges set out in the fourth schedule appropriately apply. Subsection 9BB provides for the exemption for children up to the age of 16 years from the charge arising for acute inpatient services. The bill also provides that under Section 2C and D, the existing inpatient charging exemption provision for children will not be impacted. The big difference with these amendments, or the big effect of these amendments, is to remove the acute public inpatient charge of €80 per day for children less than 16 years of age in all public hospitals. Part 3 deals with the provisions of contraception services. Section 5 amends Section 47A of the Health Act 1970 to provide that the new Section 67E of the Health Act 1970, which gives effects to the free contraception scheme for women aged 17 to 25, is included for reference within Section 47A of the Health Act 1970. Section 6 inserts a new Section 67E into the Health Act 1970. This contains the main provisions for the free contraception scheme. Within this proposed new Section 67E, there are 11 subsections, and I'd like to briefly focus on some of the main subsections now. Subsection 1 provides that the HSE will make available without charge access for women aged 17 to 25 to medical practitioners for the purposes of accessing prescription contraception, dispensing of prescription contraception by pharmacies, and the fitting and removal of long-acting reversible contraception, and that this will be free of charge. Subsection 2 provides that a woman can choose to access the scheme through any GP or medical practitioner who has signed up with the HSE as a scheme provider. Section 3 provides that free prescription contraception will be accessed via pharmacies. Section 5 provides that the Minister, after consultation with the Minister for Public Expenditure and Reform, may make regulations to vary the age cohort eligible for the scheme, allowing for wider access in the future, which is what we hope to do. Subsection 6 provides that the age cohort cannot be extended below the age of 17 by way of regulation, and this may come up in committee stage. Indeed, it's what we spent all our time in the Dáil on committee stage on. And can I just say that this subsection is in here in order for us to get this bill passed. It is not my intention that this would remain as a permanent feature in the bill, and I have asked the department to start preparing the amending legislation. We got legal advice recently that we needed to put this scheme on a statutory basis, and it was really important to me, and I think to colleagues here, that this happened before the Dáil rose for the summer, because we want this scheme in place and operational at the end of August, start of September. So I believe that the scheme should be expanded below the age of 17. The only reason this subsection is in here is to make this bill, which was put together quickly, legally robust, and the department will now be spending the time on some of the complexities. There are some very real complexities in terms of reducing the age below 17, but I'm fully committed to doing that. Subsection 7 provides that the Minister, with the consent of the Minister for Public Expenditure and Reform, may set the fees to be paid to GPs and pharmacists under the scheme. And moving to Section 7 of the bill, this contains a number of consequential amendments to the Health, Pricing and Supply of Medical Goods Act 2013. In summary then, bearing in mind all of the positive impact arising from the abolition of public inpatient charges for those under 16 and the introduction of the contraception scheme, starting with women aged 17 to 25, I am seeking support of Shannon Aaron for these really important affordability measures, and they're beyond affordability measures, certainly when it comes to free contraception. I was up with the Irish Family Planning team in Parnell Square, or on Parnell Street rather, some time ago. They were set up decades ago to respond to the impact, the negative impact on women's health at the time when contraception was banned. And it was wonderful to be up with that group saying, well, not only is it legal, we're making it free for the first time in the history of the state. And so I think whilst it is a really important affordability measure, it's also, I believe, a really important statement of intent that this government, this Oireachtas, this Seanad is absolutely serious about and committed to a revolution in women's healthcare, and this is one important part of that work. Gar Magath.
Thank you, Minister.